According to Johns Hopkins University, there are now more than 83,000 confirmed cases in the U.S. That is the most in the world, and more than 1,200 Americans have now died. The pandemic has shut down large parts of that country's economy. A record 3.3 million Americans filed unemployment claims last week. That's nearly 5 times the previous record. New York State is the epicenter, and it is clear now political leaders there waited too long to take decisive action to limit the spread. Jackson Proskow reports.
New York's hospitals are already past the breaking point.
9/11 was nothing compared to this. They just keep coming. And they're all ages. Don't delude yourself into thinking only the old will die.
Doctors and nurses overcome by the sheer number of coronavirus patients as the epidemic ravages America's largest city.
Hell, biblical. I kid you not.
At Elmhurst Hospital, where 13 patients died in a single day, the line for coronavirus tests stretches around the block.
They all have COVID.
The New York Times obtained video from inside, where staff are underprotected and overwhelmed. A refrigerated truck has been brought in to store bodies.
The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming.
At other hospitals, nurses wear garbage bags as gowns as supplies of protective equipment run low. Tents have been set up to serve as makeshift morgues.
Almost any scenario that is realistic will overwhelm the capacity of the current healthcare system.
The state's governor continues to plead for more ventilators and supplies from the federal government, but there's stiff competition.
The problem isn't just that the cases are growing every day, it is that they're growing rapidly every day.
New Orleans could run out of ventilators within a week. Every ICU bed is taken at Atlanta's 4 main hospitals. The stress on the system from COVID-19 now risks the lives of other critically ill patients.
If they're unable to, because the system is otherwise overloaded, there will be an increase in morbidity, an increase in deaths.
The White House is now working on a plan to categorize various states as high, medium, or low risk in an effort to reopen parts of the country. The unintended consequence of that, though, is that one state may now discriminate against residents from another. We're already seeing it happen. Rhode Island says it will pull over New Yorkers, and Texas says it will force people from New York and New Jersey into quarantine. Donna?
Jackson Proskow in Washington. Thanks. In this pandemic, Italy still has the highest death toll. More than 8,000 people have died there. Spain is second, more than 4,000 lives lost in that country. About 14% of those infected in those countries are healthcare workers. Doctors and nurses are among the dead. As Crystal Goomansingh reports, the scale of all of this is hard to grasp.
It is the most grim of deliveries. Truck after truck dropping off bodies at an Olympic-sized ice rink turned morgue. In Spain, more than 4,000 people have died and many more lives are on the line. Spain's King Felipe toured a new military hospital. He hopes it will ease the heroic and intense daily battle being waged by doctors and nurses. A battle shared by those in Italy. Despite the situation in Spain, Italy is still the epicenter of the European outbreak. Infections surged again, and police in Rome ramped up spot checks. Fines for breaking the lockdown went up to €4,000.
This virus is very dangerous. If you remember, we have been saying for more than 2 months now, this virus is public enemy number one.
That enemy is still spreading daily.
We must look out for each other. We must pull each other through this. Because if there's one thing that is more contagious than this virus, it is love and compassion.
Compassion also means financial support. €37 billion is on the table to help members of the European Union get through this health crisis. Crystal Goomansingh, Global News, London.
Jeff will continue to consult with experts and try to answer your questions. Send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated